For the general population, smoking is the most frequent cause of cough because that will produce chronic bronchitis and emphysema. The other group is asthmatics, which will have a chronic cough. The other ones are patients that, without knowing, might have a chronic cough due to either gastric reflux or chronic sinusitis or a postnasal drip, or because they're using a medication that can trigger a chronic cough by itself. You can have a common cold which triggers, a episode of acute coughing. Now, normally, if it is an acute infection, call it bacterial or viral, that situation should resolve within 6 weeks. If it has passed that 6 weeks, then you certainly are dealing with a chronic cough and the reason should be identified.